with you both again in this Congress. Secretary Kennedy, things are not going well. It's clear what you are doing across HHS is devastating to children, families, seniors, millions of Americans that HHS programs support. Now, you were required to send us an operating plan detailing how you are spending funds that Congress provided for programs that families rely on. You sent us what you titled the, quote, Hill version, which had over 530 asterisks in place of the funding levels. Mr. Secretary, we need the real version with actual funding levels. This committee needs to know how you are spending taxpayer dollars right now and what programs you are cutting and which you are eliminating.
What happens when the government agency that's supposed to protect America's health starts tearing it down from the inside? Senator Patty Murray confronted Health Secretary Robert F. Kennedy Jr. with a chilling warning. By blocking billions of dollars Congress already approved, HHS is putting children, seniors, and families at risk, and America's future as a global leader in medicine could vanish overnight.
You are blocking billions in funding that Congress appropriated from going out the door, including $3 billion at NIH, $1 billion in Head Start, and $3 billion in childcare funding alone. And that's on top of all the other funding you have illegally ripped away. $11 billion from state and local health departments, $1 billion supporting local substance use and mental health programs, and $66 million in Title X funds for cancer screenings, birth control, and preventive care. We know you're dismantling HHS and throwing away generations of investments in our healthcare system and firing critical employees. We are talking about the people who administer Head Start, LIHEAP, Meals on Wheels, or entire teams who are working on preventing chronic disease and Alzheimer's, tracking IVF success rates and safety, maternal health, more. On top of all of this, you propose a budget now with truly devastating cuts that would leave America sicker and weaker. But you're not waiting to see whether Congress approves that budget proposal. This administration is starting to unilaterally implement it right now, in defiance of Congress and the laws we passed. If you aren't already, you're sprinting down the road of illegally impounding billions in funding through intentional action and incompetence. So to my colleagues on this dais, we heard several weeks ago from experts across the country what we risk by ceding American leadership on biomedical research. If we bless these staffing and funding cuts across HHS, that means deciding that we are comfortable with China leading the future development of every drug, device, and vaccine. The supply chain challenges we faced during the pandemic will be the new normal. Our access to the latest treatments and cures will depend on other countries. It's time to stand up and assert Congress's authority. This committee has dedicated itself in a bipartisan manner over decades to make sure we are the global leader in research and development. And now all of us know this administration is now setting us back where it may take decades to regain that position. If we don't, decades of scientific breakthroughs and medical discovery and the bipartisan work to support them risks being burned to the ground, and it will be very, very hard for us to rebuild that. We should be setting this country up for failure. We have to do better. Now, Secretary Kennedy, listening to your testimony last week, frankly, left me pretty confused and concerned about what is happening at your department. You repeatedly claim that staffing and funding cuts that have been reported on publicly and even confirmed by your department staff are not happening. So either you're lying or you're not the one making the decisions. You said, and I quote, "I made sure that Head Start was not cut," later going on to say there should not be any delays, the funding is there. Well, Mr. Secretary, HHS is delaying billions in funding for Head Start and childcare. These funding delays meant that a Head Start program in my state that serves more than 400 children had to close its doors and left parents scrambling. So let me ask you about another childcare issue. Secretary Kennedy, whose decision was it to withhold childcare and development block grant funding?
Senator, I want to point out that in 2021, at the beginning of his administration, President Biden submitted his budget on May. You know what? You made an accusation of me, and I'm going to answer it.
Okay, I appreciate
On May
that.
28th, he submitted his budget. So our budget. We're a new administration.
Okay, you can go
And I also want to point out.
I have just 2 minutes left. I asked you a specific
I want to
question.
point out something, Senator. You presided here, I think, for 32 years. You presided over the destruction of the health of the American people.
Well, I have
Our people are now the
Mr.
sickest people in the
Secretary,
world.
seriously.
Because you have
Mr.
not done your
Secretary,
job.
seriously. That is an
What have you
amazing
done about it? What have you
Mr.
done about the
Secretary,
epidemic
I am here
of chronic
to ask-
disease?
Mr. Secretary,
What
you
have
are
you done
here in
about
front-
the epidemic
Mr.
of chronic
Secretary,
disease?
seriously, Madam
Mr. Secretary,
Chairman.
I would ask you to hold back and let the senator ask the questions.
Mr. Secretary, I'm asking you a question about childcare. I'm asking you who made the decision to withhold childcare and development block grant funding.
That was made by my department.
Okay, and you said last week, quote, "We were not cutting thousands of scientists, we are not cutting clinical trials." But I want you to know, in the last 4 months, you fired or pushed out nearly 5,000 NIH staff and terminated more than 1,600 NIH grants. That includes more than 240 clinical trials across the country. So whose decision was it to fire scientists and terminate these NIH grants and the clinical trials?
Senator, I don't trust your information with all due respect. You told me 3 days ago or 4 days ago that we had cut a clinical trial in your state, and what you said turned out to be completely untrue, and you knew it was untrue because you corresponded with Jay Bhattacharya before
Madam
that.
Chairman, I will answer that. It shouldn't take me, first of all, raising an issue with you face to make sure NIH is working its way through this. The woman that was in question, as I clarified to you at the last committee, was qualified for a clinical trial, unlike you stated. So
Untrue. Untrue.
No, that is true.
Untrue. She qualified this week. We shouldn't be talking about patients' private information
I agree.
anyway.
And let's leave that. And I will just say your staff didn't get back to me till 45 minutes ago.
We have the emails. We have the emails from your staff
Madam Secretary,
2 weeks ago.
Mr.
2 weeks ago, you were
Secretary,
corresponding.
seriously.
What you said you knew was untrue when you said it to me.
You came here to argue with me. I came here to ask you questions about your budget request. Your budget request is asking us to cut dramatically, but I am also making the point that Senator Baldwin made, that what you are doing right now is enacting your budget that Congress has not passed by cutting critical funding across the board. And I think this committee will find that to be very detrimental in the future. Thank you, Madam Chair.
Senator Hyde-Smith.
Thank you, Chair Capito and Ranking Member Baldwin, for this meeting.
Senator Patty Murray didn't just question Secretary Robert F. Kennedy Jr., she unloaded a series of charges that cut to the very heart of how government works and who it's supposed to serve. Her message was simple. The Department of Health and Human Services, under Kennedy's leadership, is not just mismanaging programs, it's dismantling them, leaving millions of Americans exposed, unsupported, and vulnerable. Her message was simple. The Department of Health and Human Services, under Kennedy's leadership, is not just mismanaging programs, it's dismantling them, leaving millions of Americans exposed, unsupported, and vulnerable. Now, at first glance, this might sound like typical partisan bickering, a senator grilling an administration official. We've seen it before. But if you look closer, what happened in that room wasn't business as usual. What Murray laid out was a roadmap of what happens when ideology collides with the machinery of government. She accused Kennedy of blocking billions of dollars that Congress had already approved, taxpayer money meant for programs that keep children in school, seniors healthy, and families afloat. We're talking about Head Start, cancer screenings, childcare programs, and even critical research at the NIH. These aren't luxury items. These are lifelines. Think about what it means for a Head Start program in Washington state to close its doors because funds were delayed. That isn't just a line in a budget. That's 400 children suddenly left without early education and care, and hundreds of parents scrambling to figure out how they'll work and provide for their families. Meals on Wheels cutbacks don't just save a line item on a spreadsheet. They leave elderly people without the food deliveries they depend on to survive. When NIH grants are canceled, that's not abstract. That's real scientists losing their jobs, real clinical trials for cancer or Alzheimer's being shut down, and real patients left without hope for new treatments. Murray made an even larger point. This isn't just about today's struggles. It's about the future of America's role in global innovation. For decades, bipartisan investments have kept the United States at the forefront of medical research and scientific breakthroughs. If those investments are allowed to wither, we risk ceding that leadership to other nations, particularly China. And once that ground is lost, it could take decades to recover. Imagine a world where the next vaccines, the next life-saving cancer drugs, the next major medical breakthroughs are all developed abroad while Americans wait in line, dependent on other countries for cures. That's the trajectory Murray is warning about. But instead of addressing those concerns with clarity, Secretary Kennedy went on the defensive. He denied the cuts, pushed back against the reports, and even turned the criticism around, accusing Murray herself of presiding over the decline in American health over the past 3 decades. It was a remarkable moment because rather than provide transparency, Kennedy chose confrontation. He seemed more interested in assigning blame than in explaining why so many programs are underfunded or stalled. And here's the bigger issue viewers need to understand. Congress, not the executive branch, controls the power of the purse. That's in the Constitution. When an administration starts unilaterally holding back funds that Congress has already approved, it's not just bad management, it raises serious constitutional questions. Murray's warning was clear. This could amount to an illegal impounding of funds, a practice the law was designed to prevent after past abuses by presidents who tried to override Congress's authority. So what we're seeing here isn't just a policy disagreement, it's a test of democratic checks and balances. If the administration can simply ignore Congress and withhold funding for programs it doesn't like, then what stops it from dismantling any part of government it disagrees with? And what does that mean for the millions of Americans who rely on those programs to live, to learn, to heal, to survive? This hearing wasn't just about Patty Murray versus Robert F. Kennedy Jr. It was about whether America still values its investments in science, in public health, in its children and seniors. It was about whether facts and accountability still matter in government decisions. And most of all, it was about who pays the price when politics comes before people. If you're a parent who suddenly can't afford childcare because federal funds are being delayed, if you're a senior who no longer gets that hot meal delivered each day, if you're a patient waiting on a clinical trial that could change your life, then you're not watching a political spectacle. You're living the consequences of these choices. That's why this moment matters. It isn't just Washington drama. It's a fight over the soul of America's healthcare system and its future as a leader in global science and medicine. So I want to hear from you. Do you think Senator Murray is right that the administration is dismantling healthcare from within? Or do you think Secretary Kennedy has a point that Congress itself has failed the American people? Share your thoughts in the comments. And if you want to keep cutting through the noise to understand what's really at stake in moments like this, make sure you subscribe and stay tuned right here on Liberal Lens.